Hello, I'm Dr. Jill Westfall with SpinalWorks, and today I want to talk to you about pregnant women. I oftentimes get the question, do you treat women that are pregnant? Or can a chiropractor treat a woman who's pregnant? Absolutely. And it's my suggestion to get chiropractic care while you're pregnant. During the first trimester of pregnancy, it's contraindicated to have any type of adjustment or therapy during that first very, very delicate trimester of pregnancy. So during those first 3 months, unfortunately, you can't receive treatment, and typically at that point your body hasn't changed enough that you'd be in need of it. After that first trimester, you can absolutely receive chiropractic care. And if you think about the way that the body is formed, we have this pelvic bowl that the baby is sitting in, and it's going to keep growing. The baby's going to keep growing and growing. And at times, your back can go out of position. And so I see patients that are in extreme discomfort, unfortunately, sometimes. And that pelvic bowl has just changed. It's shifted. And so now that it's shifted, you can imagine if this is the hole that the baby is supposed to be exiting from, and now it's shifted, you could imagine that's changing the dimensions of the birth canal. And now the baby doesn't have a proper exit from the body. Sometimes the baby will head out of Dodge. I see patients that come in and the baby is in a breech position. I do not claim to turn babies, but I can tell you that there are times where babies are sitting inside of a pelvic bowl that is out of position, and the baby will move out of that position because it's uncomfortable. And when that's put back into position, the baby will move into position because now it's a comfortable place to be, and that's what's natural for them. So getting adjusted during pregnancy is actually very helpful for those women that want to have a natural childbirth and are not having a C-section. It will make it easier, and most of the time it will help to reduce any emergency C-sections or times where the baby is just unable to exit your body. Being able to get adjusted and keep your body in pure form, in the way that it should be, and having everything in alignment when you go in to give birth, it will only help and not hurt. I've treated many, many, many women. I myself got treated throughout my pregnancy as well, just to be sure that my body was working optimally as it grew with the baby. As any pregnant woman would know, your body is shaped into all of this different wild way when that baby's forming, and it can send things off in all kinds of different directions, and sadly it can become very uncomfortable for people. So being able to come in, get a chiropractic adjustment, get some very mild stretching, and get some therapeutic massage to be able to help to relax the muscles and allow your body to function properly can be very, very comforting for a woman whose body is changing greatly through this process. I have treated, as I mentioned, many, many people, and it's very important if you're going to be treated by a chiropractor during pregnancy that you're going to someone who has done it before and who feels very comfortable. Since you're in a very delicate state and you have this beautiful life growing inside of you, it's something that you want to make sure that the doctor that you're seeing is someone who feels very, very comfortable treating someone who is pregnant. And if you know someone, or if you are pregnant and you would like to be treated, please call me. I would love to be able to evaluate you and see how we can help you have the most comfortable pregnancy possible. Please let me know. I'm Dr. Jill Westfall with SpinalWorks, and we've got your back.